Good morning, students. Today we are going to discuss the Norma Lateralis. So what are the different bones which are visible in this view? So this is the frontal bone, then comes the parietal bone, then comes the temporal bone, then comes the zygomatic bone, then this is the occipital bone, then this is the squamous part of the temporal, this is the Mestroid process of the temporal bone, then this is zygomatic arch, then maxilla is visible. You can see in the lateralis, this is the maxilla bone. Then these are the nasal bones. Now, in the lateral view, in the temporal region, superior and inferior temporal lines are visible, but in this skull, we can make out the inferior temporal lines. Now, these inferior temporal lines, as they are going posteriorly, they end at this level as the suprametal crest. So this is the suprametal crest, clear, which is just above the external acoustic meatus. So this is external acoustic meatus. Above this crest is present, which is known as the suprametal crest, which continue with the inferior temporal line. So these are the this is the inferior temporal line continuing with the suprametal crest. Now this region is known as the temporal fossa. Now this temporal fossa, it is formed by what are the different bones which are forming it. So that this is the squamous part of the temporal bone, this is the sphenoid bone. So this, you can say the anterior wall of this temporal fossa is formed by the sphenoid bone, and inferior it communicates with the infratemporal fossa. So this is the infratemporal region. So this temporal fossa, it communicates with the infratemporal region through this gap which is present between this zygomatic arch and the temporal bone. Now the different sutures which are visible in this region is, you can see this is the frontal bone. So this is the greater wing of the sphenoid. So this is frontosphenoidal suture. This is the frontosphenoidal suture. This is the parietosphenoidal suture. You can see here. This is the parietosphenoidal suture. This is the temporosphenoidal suture. Clear? Then you can see this H-shaped structure is formed in this region. The H-shaped structure is formed in this region. This is known as the pterion. So pterion is the point which is just 4 centimeter above the zygomatic arch, like this, and about 2.5 centimeter from this zygomatic bone. So this is the landmark of the meeting point of the 5 sutures. So what are those 5 sutures? First is, that is between the frontal and parietal bone, that is frontoparietal suture. So this is the suture which is known as the coronal suture 2. Then this is the frontal and sphenoidal frontosphenoidal suture. Then between the parietal bone and the greater wing of the sphenoid, this is the parietosphenoidal suture. Then this is the temporosphenoidal suture. So the meeting point of these 5 sutures, they form H-shaped structure over here, which is known as the pterion. Similarly, on the posterior side, so this is the parietal bone. Now this is the occipital bone. Now this occipital bone, this is the mestroid part of the temporal bone. Now the meeting point of these sutures at this point, this is known as the esterion. So the esterion is the point where these 3 sutures, they are meeting. What is this suture? This is the lambdoid suture. This is the occipito-mestroid suture. This is the parieto-mestroid suture. So the meeting point of these sutures at this level, it is known as the esterion. So in infant, it is known as the posterolateral fontanella. So this is also known as posterolateral fontanella. Now this is the mestroid part of the temporal bone. Now if we see the part of the temporal bone, this squamous means smooth part. So this is the squamous part of the temporal bone. This is the mestroid part of the temporal bone. In front of this mestroid process, there is an opening which is known as external acoustic meatus. Now this external acoustic meatus, if we see, so it is covered by a plate. You can see a plate over here. So that is lower part of the anterior margin, then inferior margin, and this posterior part. So lower part of this posterior part, it is just covering the external acoustic meatus, and this is known as the tympanic plate. So this is the tympanic part of the temporal bone. This is the mestroid part of the temporal bone. This is the squamous part of the temporal bone. So what is visible in Norma lateralis? Another structure which is visible is a zygomatic arch. Now how this zygomatic arch is formed? It is formed by the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. So this is known as the zygomatic arch. Now if we see this zygomatic arch, it has the superior border, it has the inferior border. Now inferior border has a tubercle. You can see here is a tubercle. Basically this tubercle is present at the level where the zygomatic arch is just fusing with this temporal bone. So the fusion, where the fusion is happening, just at that level, this articular tubercle is present. Now this is known as the mandibular fossa, where the head of the mandible it articulates. So in the posterior portion of the external acoustic meatus, so where this zygomatic arch is just ending or just joining the temporal bone, as I have told you, this is the suprametal crest. Clear? So suprametal crest is there. So another important landmark over here is the suprametal triangle. So what are the boundaries of that suprametal triangle is? Above it is bounded by the suprametal crest. So anteriorly it is the posterior margin of the external acoustic meatus, and third is the tangent is drawn along the posterior margin of the external acoustic meatus. So this triangle is formed in this region, which is known as the suprametal triangle. Now another structures which are visible in Norma lateralis is, this is the maxilla. This maxilla, as we just trace it posteriorly, so it is forming the anterior wall of the infratemporal region. So this is the infratemporal region which is lying below the temporal bone. So it is forming the anterior wall of that infratemporal region. Now here these are the nasal bone which are also visible in the Norma lateralis. And another important structure which is visible here is the frontal process of the maxilla, and this is the lacrimal crest of the maxilla which is visible in the Norma lateralis too. So these are the important bones which are present here. Now the suture which is separating the mestroid process from the occipital bone, so near that suture the mestroid foramen is present. You can see this is the mestroid foramen through which the emissary veins they pass through this foramen. So these are the important structures which are seen in the Norma lateralis. So if you like the video, please share it and subscribe it. So thank you very much.